Hi, I am Dr. S Honnani, surgical gastroenterologist. Today I am going to speak about fissure in ano. What is exactly fissure? Fissure is actually when a patient passes very hard stool, when it passing through the anal canal is stretched and it causes a laceration in mucosa and that becomes an ulcer. That is called fissure. If it happens suddenly, it is called acute fissure in ano. If a patient persistently develop this or it fails to heal, then it is called as chronic fissure in ano. Now what exactly happens in this case is when the patient passes motion, they will have pain while passing motion as if somebody is taking a knife and cutting in that area. Also they will have pain or burning sensation for another 10 to 15 minutes even after passing the motion. Most of the patient presents with. But when the patient comes to us, what they say is, sir, I have got piles. But they should not be said like that. Actually what you are suffering, like suppose you are having pain while passing motion, you should say that I am having pain after passing motion. How long it stays, whether pain is continuously present. If pain is continuously present with irrespective of patient is passing motion or not, it is some other condition called perineal abscess, thrombosed hemorrhoid, so many other conditions are there. Fissure is one of the simple condition which we can manage with the medicine in more than 95% of the patients. So you need to understand the mechanism why fissure fails to heal. When there is a fissure, when the patient passes motion, it irritates the ulcer and it causes pain. Because of this pain, the sphincter tone increases, the sphincter muscle also become contracted, and because of it is contracted, it is kind of rubber band effect. It prevents the blood supply to the ulcer or whatever the ulcer it is there. Because there is decreased blood supply, this fissure fails to heal. So it becomes a vicious cycle. There is a irritation, increased spasm, decreased blood supply. So we have to break at some point and this circle. We can decrease the spasm of the muscle either medically or surgically. Patient comes to us with a fissure. 95% of the time we can give a better cure only with the medicine. What we do is we will give some medications, especially ointment, and they have to apply 3 to 4 times a day for a period of 45 days. But among patient, what I find is we will advise them to apply. Most of the time, see, imagine this is the anal canal. Most of the time they take the ointment, apply outside. The problem is the fissure is inside the anal canal, so when they apply the ointment, it should go inside the anal canal at least up to 1 centimeter. So easiest way of applying is take a 1/2 to 1 centimeter of ointment over the finger and place at the anal verge and just put a pressure so that ointment will go inside. So when doing this, what will happen is medicine is supplied to sphincter muscle and sphincter muscle relaxes, it will increases the blood supply and it will heal. And second thing is keeping the area clean, means after passing motion it has to be washed with a jet gun nicely. So like for Western people they say that sitz bath. Most of the Indian population, Arab population, sitz bath is technically not required because we have the habit of washing that area, whereas West people they use tissue. So that to keep the area clean, we advise sitz bath, so that when they sit in the hot water that area become clean. So sometimes sitz bath helps. Suppose patient has passed motion and patient is having burning sensation in the anus. In that case, when they sit in the hot water, it gives a soothing effect. Beyond that, there is no much benefit for, especially for Indian and Arab population. First, whenever patient comes to a fissure, we first treat with medicine, and most of the time the problem with the patient is they don't take the treatment for a specified number of days. Usually what you think is that anus doesn't have rest, every day it has to work. So when we apply the ointment, they have to apply the ointment at least for 45 days. So if they apply for a week and they feel better, if they stop, then disease will recur, because that area, since it doesn't have a rest, it will take at least 1.5 months to heal. So you have to complete the treatment for 45 days. So once you do this, 95% of the time the patient will get the cure. There is something called chronic fissure in ano. In this case is what will happen is, because of recurrent fissure, the ulcer become fibrous and refuses to heal, and these are the patient they doesn't heal with medicines. These patients actually require surgery. What we do is something called fissurectomy. We put them under anesthesia and we excise the fibrous part of the ulcer. While doing so, we also do the lateral sphincterotomy. In this case, sphincterotomy means we cut around 1 centimeter of the sphincter muscle. This can be cut with the cautery or it can be done in laser. With the laser thing is that there will be a very kind of needle and the cut incision is very small and there will be very less pain. Even with, if you use electrocautery, now current we have certain special kind of anesthetic medication. When we give, patient will be having painless surgery. Only 5% of the fissure population requires surgery. In this 5%, only 1% may recur with the disease even after the surgery. In these cases, we have something advanced surgical advancement flap and all. But whenever you have a fissure, thing is that don't neglect it and get a treatment from a trained surgeon, because most of the time in India I am seeing is whenever there is a bottom problem, like maybe it is a hemorrhoids, maybe fistula or fissure, whatever it is, most of the time they go to a local pile specialist. These are actually quacks who doesn't have any medical training, and when they get treatment from them, it lead to a lot of complications like anal stenosis or ulcers becoming more, and ultimately end up in spending more money. So whenever you have a painful defecation and if it is fissure, take a treatment from trained doctor. Please like, share and subscribe my channel so that I can make more informative videos about J Health.